Hello all and welcome. As the AMA philanthropic arm, the American Marketing Association Foundation elevates marketing visionaries, empowers future generations, inspires a more diverse industry, and ensures marketing research impacts the public good. The AMA Foundation presents awards to exceptional marketing students, researchers, academics, and professionals. These awards honor influential and transformative leaders and their work. The Nonprofit Marketer of the Year Award honors regional and national nonprofit marketers who are extraordinary leaders in the field of nonprofit marketing. The Nonprofit Marketer of the Year Award is made possible through its founding sponsor, Lipman Hearne. Today, we'll speak with this year's winners as they share their perspective on leadership, growing in times of change, and how their award-winning work can be applied to any nonprofit organization. Please join me in congratulating and welcoming this year's winners. Our national award recipient is Amy Pearson Wales, Senior Vice President of Communication and Public Affairs at SightLife. And our regional award recipient is Christian Doucette, Director of Community Engagement at Caring Kind, the heart of Alzheimer's caregiving. Amy, congratulations on this achievement. If you could please introduce yourself and your work to the audience.
Thank you, Molly. Greetings and good morning from Seattle. I am delighted to share in conversation with you today and truly honored to be recognized by the AMA Foundation as National Nonprofit Marketer of the Year. I share this recognition with my team at SightLife, our many cross-programmatic collaborators and partners over the last year. Even during a pandemic, SightLife is on a mission to eliminate corneal blindness and the health inequities that perpetuate it worldwide. We serve the gift of sight, but our work extends beyond it because when we save or restore sight, we also renew hope and healing. I have the privilege of serving this mission as SightLife's Senior VP of Corporate Communications and Public Affairs. I've been in this role for 2 years. Before joining SightLife, I served in various agency and in-house roles at the intersection of public health advocacy, innovation, and product development. The most important role of my life, however, is being the mom of twins, Sonia and Joran, who are full of beans and may indeed come into the frame this morning. You might also see our cat Jack, as is the norm when working from home. I appreciate your grace, everyone's grace. This is our new normal. It's a tremendous opportunity again to be with you. And to Christian, it's been tremendous reading of your accomplishments at Caring Kind, and I look forward to our conversation.
Great, thank you, Amy. Christian, thank you also for joining us today, being here, and congratulations. So would you please as well introduce yourself to our audience and the work that you do?
Absolutely. Hi, everyone. I'm Christian Doucette. I'm the Director of Community Engagement at Caring Kind, the heart of Alzheimer's caregiving here in New York City. I'm coming here from New York City. I live in Queens. Thank you to the AMA Foundation, American Marketing Association, and to Lipman Hearne, sponsor, for this incredible award. As Amy said, I shared too this award and this honor with my team, all 30 staff people at Caring Kind, and our board, and our volunteers, and our community of caregivers. And our community caregivers are the people that make Caring Kind what it is. Caring Kind is formerly known as the Alzheimer's Association New York City chapter. For a number of years, we were a chapter of a much larger organization. And in 2016, we disaffiliated from the Alzheimer's Association and rebranded as Caring Kind, the heart of Alzheimer's caregiving. Doing that, we refocused our mission from fundraising for a cure to focusing on Alzheimer's caregiving and Alzheimer's caregivers and people with dementia. And I look forward to talking to everyone about the kind of work that we did. And I look forward to hearing from Amy about the work that she's done at SightLife. But I want to thank again everyone at the American Marketing Association for this recognition.
Great, well, congratulations again to you both. So with that, we'll dive into our panel questions. So the Nonprofit Marketer of the Year Award is presented by the AMA Foundation. Can you elaborate a bit on what being part of the AMA community means to you, both personally and professionally? So I'll have Amy kick it off.
Thank you, Molly. And it's a great question. When I started my professional career 2 decades ago, I did not know much about the art and science of marketing, but I felt drawn to storytelling. It wasn't until perhaps maybe 10 years ago that I realized why. It was Liz Medicine Crow, CEO of First Alaskans Institute, who shared with me that her community, a community of storytellers, believes that the closest connection between two people is a story. And with those words, I realized why marketing called to me. It's about drawing connections between people, bridging divides, whatever those divides might be, to build community. Marketing is also about nurturing community over time. That's because community isn't static. In the words of Hegel or Michelle Obama, it's constantly becoming, evolving, shifting, reshaping. And what I love about the AMA community is the diversity of perspective, talent, and expertise at the table, the willingness and appetite to explore what's best and what's next. But you know, in today's world, an increasingly digital first virtual world, scale is seemingly at the push of a button. So what I love about the AMA community is our underpinning dedication to story. Dare I say the stuff that matters, you know, not necessarily scale. Scale can be important, but something more like substance is what resonates the most with me.
Great. We'll pass it to Christian. Same question. What does being part of the AMA community mean to you?
Yeah, absolutely. And I'm so glad that you said that, Amy, because storytelling is exactly what I do here, Care and Kind as well. And storytelling is what matters for people, right? People don't respond to facts and figures. They respond to relating to other people. We launched when we launched a podcast about Alzheimer's caregiving, we really should have done dementia training, but there were other podcasts that did training. And so to be one more didn't seem relevant. What seemed relevant was for people to share their experiences. One of the most complicated things and one of the most challenging things about being an Alzheimer's caregiver is that you often feel alone. You're home, you're isolated, you're taking care of someone who depends on you. You often can't leave the house, right? So creating stories and interviewing caregivers just about their personal journey. What worked, what didn't work, what was challenging, what was unexpected, what was amazing, what was funny, you know, all of the challenges and the joys and the hardships and the family, all of that is storytelling. And so when you have a diverse set of stories, then, you know, not every story will resonate for someone, but the one that does resonate means something to people. And so hearing people tell their stories encourages people to talk about being an Alzheimer's caregiver and then getting the support that you need. And the thing about the AMA community, which is so great, is that, you know, having worked for community-based nonprofits all my life, I know that I'm often in a department of one. We're all often in departments of one. And while you might be working with a team, those teammates are also working on their own projects. So the nice thing about the AMA community is a resource. Other people in your same situation trying to achieve their objectives through marketing and communications. And if you're going to try a new thing, then you have a community of support of people who have already done it. And so again, just like Alzheimer's caregivers can sometimes feel isolated, marketing staff of one person can feel isolated too. And so that's what's so great about not only the AMA community, but the importance of every community.
Absolutely. Well said. So we're still in unprecedented times, right? Still kind of deep in our COVID reality, our new normal, as Amy said. What unique challenges has COVID posed for each of you? You work for quite different nonprofits and organizations, size, mission, scale. What specific challenges did each of you see in mission delivery, fundraising, things like that? So we'll start with Amy.
Oh, thank you for that question again. You know, the time of the session may not be long enough. COVID-19, the pandemic, has upended our way of life holistically. And so for an organization, our way of business was also disrupted. And I could speak to how those disruptions affected all of us across different divisions and the like. And that's because they did. But I think it's important to realize that at the core, what fundamentally disrupted our organization was how our staff were affected by the pandemic. Not just, as I mentioned, because we might have children coming into frames or a cat or a pet at home, but we work in the space of death and dying and grief every day, 24 hours a day. And our staff are equipped to navigate that. And yet when it hits home regularly, over time, again and again, we had staff members lose multiple family members. We had staff members who became, really, they were struggling under the pressure points, various pressure points of the pandemic. And I think the most important fundamental thing about an organization doing its best work is being able to provide the best kind of work environment for its staff, a work environment that prioritizes their health and safety, which we did from day one. As I mentioned earlier in the green room, we have programs and staff members in China. And so in late 2019, we were aware of the pandemic and how it was bubbling up in China. And we were aware that it would likely spread, and we were anticipating that it would, and it did hit home in terms of headquarters, but all the offices where our staff work. And I think the most challenging thing for us has been holding our staff close, caring for them, and making sure that they had what they need to be their best selves at home, but also to show up and do their best work for the people we serve.
Absolutely. So Christian, same question. What unique challenges did your organization face, starting March 2020, specific to the work that you do?
Yeah, of course. And I will, agree with Amy that kind of just the organization's response to trying to do work while also experiencing the pandemic ourselves as individuals and as a team, it impacted everyone personally and professionally. So just managing that process is really challenging, and it's challenging for everyone. It is really especially challenging for New York City, right? New York City was on a couple of fronts. Number one, New York City was really the first to be hit hardest, right, in the global, not the global pandemic, but in the U.S. and specifically nursing homes, right? Nursing homes and COVID-19. Hit the most vulnerable people first, and vulnerable people are the oldest and the sickest, and that includes people with Alzheimer's and dementia. And you can see all of the headlines around in all the papers about how hard hit nursing homes were, and especially elderly people with Alzheimer's and dementia. So not only did the staff have to worry about this pandemic and reorganize, we also, the need for our organization doubled because families were just blindsided by this. And so we had staff who were personally affected by COVID-19 and had losses in their own family. So how to kind of keep the plane going while you're rebuilding it and switching people around was a real challenge. And the last thing I'll say about that is about culture. We for 40 years, we have been a high touch person to person organization. People would come to our office and come to a support group, and hands are held, shoulders are cried on, right? We have a very personal, high touch approach to the work that we do. The forced transition to digital was very difficult for this organization, just because it felt antithetical to the work that we do. And the most surprising thing is when we did it and we leaned into it as much as we could, we found that digital really did add value, and it was really important, and it will forever be a part of the work that we do. Because what we discovered is that a lot of people couldn't come to the office for a variety of reasons, because of caregiving reasons, because of mobility reasons. And digital allowed us it allows us to now access people and get in touch with people who otherwise couldn't make it physically into the office. So it's been a curse, of course, pandemic, but it's also been a blessing.
Great point. Really, I think possibly a universal silver lining to working during this time is finding new solutions, building out those digital capabilities that maybe we were all kind of putting off, before COVID. So obviously the COVID pandemic required organizations to pivot with purpose and to adapt really, really quickly. So how did you strategize your organization's needs and remove handcuffs for your teams to ensure that work could be done quickly? So Christian, we'll start that one with you.
Yeah, sure. This is really like the logistics part of it. What did we do, right? We were lucky on a couple of fronts. Our director of IT it kind of transitioned us to web-based solutions a couple of years ago, and so we had already started that process of being able to access things remotely. We certainly didn't do any Zooming or video-based work yet, but at least all of our kind of like servers and email went to a web version so that we could access them anywhere. So we were very lucky that we put all of our data into that format. We were also really lucky in that the podcast that I've already referred to, we started that in March of 2018, and by the time COVID hit in March of 2020, we had gotten almost 20 episodes done. And that allowed us, obviously, and this is the value of digital assets, right? They live digitally. They're always accessible. They work 24/7. And so that allowed us to still provide care and support, however, virtually, in a kind of passive way for anyone who needed us at any time. And certainly, look, we leaned into all of those assets that we had built, and we encouraged staff to find any way they could do their work remotely and safely. And that includes, all of our community fundraising events. Our walk is our largest, community fundraising event of the year. Most of our events had to be canceled, right? Because the marathon, the half marathon, the bike tour, all of these, the gala, all of these in-person events had to be canceled because you could not assemble. And that really set us back, easily over $500,000 lost because we couldn't do the work. And virtual is nice, but that's one thing you can't do. It's harder to do a virtual bike ride and have that same feeling and maintain those relationships. And so one thing and the last thing I'll say on this is that we were kind of lucky in that our walks happen in the fall in New York City. And so because the COVID pandemic hit in March, we decided very early on to pivot to virtual. And so we had about 3 or 4 months to really build up our, virtual presence and produce, over 25 videos in support of the walk. And if we're going to be virtual, let's gather people around virtually and get them used to logging into, viewing a live stream every Wednesday at 1 o'clock from my kitchen and looking at social media videos that we create to address COVID-19. To go onto webinars and really kind of build up our social media presence online, just to get that muscle memory going, so that people can attend a virtual event and have it be meaningful and have it be effective.
Great, really inspiring examples, and I think really kind of specific and actionable, which is great. So same question to you, Amy. How were you able to kind of quickly re-strategize, take some handcuffs off of your team and really pivot, to our new normal?
Sure. Yeah, I'm laughing because I didn't realize I had put my team in handcuffs pre-COVID. I should look into that and really sort of explore whether or not they were. Look, we adapted in an infinite number of ways. It's uncanny, but also not surprising that many of our challenges are the same challenges that Christian just described. And Christian was so eloquent. It's hard to follow, but absolutely, the transition to digital was fundamental. And also we had to reconceptualize how we tell stories, how we capture interactions in this digital era. But I want to take a step back too and really recognize that we are an organization, and I'll explain this in greater detail at my session in an hour. But we are a cost recovery organization. We don't have reserves. This is how the donation and recovery system in the United States works. It's federally regulated and the like. And so when COVID hit, when elective surgeries, especially corneal transplants, were canceled, suspended, to move resources, staff to the front lines in the early days of the surge, which we fully supported as a public health organization, we did not have the resources to pivot quickly. And so initially what we needed to do was, frankly, narrow our focus and go to our specific longtime supporters and say, we have an emergency, we have an immediate need, because in order to bridge to the other side, if you will, we need to digitally transform our learning modules for in-person clinical trainings. We need to transform our the way by which we execute bereavement care with our donor families. And that was challenging because those were asks that had never been made before. It took courage, it took modeling fearlessness to be effective, but it also was rocket fuel for me because we had an urgency to move forward or risk closure. And so when I called elected officials, congressional staff, when I absolutely advocated morning, noon, and night, there was a sense of this needs to happen now or tomorrow. There is no tomorrow, right? And so for me, it was one of those things that, again, Christian laid out beautifully all the details that we needed to put together and make happen. But for me, the biggest pivot was really reconceptualizing our fundraising. And we were able to do that in a number of different ways. But the biggest piece was actually standing up a public affairs government relations division, which we had never done before. And by division, it was essentially a team of one because I, wear a number of different hats, but I still needed to take on that extra work. And so I think that we share, these commonalities in terms of making that digital transformation. But the way by which we had to do it was driven with fundamental urgency. And we're not talking about months to months, we're talking about days to the next days to the full week. And that was critical for us.
Absolutely, that agility, I think, is definitely a common theme that many nonprofits share. So, similar vein, what are some of the benefits of working at a nonprofit at a time during a time of such massive social change, new normals, social movements? What do you say is kind of the best part about working at a nonprofit? So, Amy, we'll kick it back to you for that one.
Well, I love working with people who are passionate about what they do and bring that passion every day to their work. And I have had the privilege of experiencing that across different sectors, right? But particularly at SightLife, we have been, serving the cause of sight restoration and blindness prevention for over 50 years. And there are some members of staff who have been with us for decades. That kind of dedication is inspiring, right? And the more inspiration that you bring to your day-to-day, especially in times of crises, at least for me, the more rocket fuel I have to do what needs done. I've been thinking a lot about the benefits of working at a nonprofit organization, and I'm not entirely sure that it's necessarily about working at a nonprofit organization. I think at the end of the day, it's about working for a cause that you believe in, working with people who share that passion, that dedication, that commitment. and doing great work in the world, no matter the speed bumps, right? And overcoming those speed bumps, finding those moments of inspiration and carrying those forward. That is something that anyone can bring with them, no matter where they work. I do want to point out that for Site Life, it is critical that our employees demonstrate a commitment to our values and the cause of donation. But working at a nonprofit doesn't make a person less racist, sexist, or conversely more anti-racist and feminist. You know, it is really about the people at the end of the day, and what brings us together. And for me, the Site Life family is an incredible family, and we really came together in times of needs, not just for each other, which was fundamental, but for the people we serve. We believed that sustainability, carrying forward our mission, was important, and we worked to make it happen.
Great. Christian, same question. What would you say is the benefit of working for a mission-driven nonprofit at a time of such massive national change?
Yeah, of course. I mean, I've only worked for nonprofit organizations in my career, so it's really the only world I know. But I would echo what Amy said, which is that whether it's a nonprofit or for-profit, if you're surrounded by passionate people who care about what they do and are creative, and they come to work fully formed and ready to accomplish big goals, that's exciting. And so I think that I've experienced that through the nonprofit lens, right? And I decided to go into nonprofits because I thought if I have to work, and I do, I am not independently wealthy, I may as well work for good, right? I may as well address, work on the issues that matter to me. And at nonprofits, it's where I met the most passionate, dynamic people in the world, willing to work 60 hours a week for a $20,000 salary. And if you're willing to do that, then you have passion for what you do. And at Care in Kind also, we have people who we have a volunteer support group leader who has been doing it for 30 years, right? And that's as a volunteer. We have walkers who come to our walk events every year, and they've been doing it for 20, 25 years. And so it's not just about staff, it's about what motivates you, what brings you to the table, and what keeps you coming back, whether you're staff or board or volunteers. That kind of passion that drives you to keep coming back and being committed, that's what really matters. And, ultimately, I currently work in the field of Alzheimer's caregiving, right? And on the surface, that doesn't seem to have very much to do with social justice. But I think one of the great lessons that I hope everyone has learned over the past few years, especially with the rise of Black Lives Matter and other social justice movements, is that the message is, it doesn't matter what your mission is. Social justice is everyone's responsibility, both personally and professionally. And it's incumbent on everyone to view their work through the lens of diversity, equity, inclusion, and justice. Whether you're a kids nonprofit, Alzheimer's nonprofit, a corneal transplant nonprofit, everyone has a responsibility to come with more than just your mission in mind. You have to have everyone in mind. And at Care in Kind, it's one thing to say that, right? Talk is cheap, but it's another thing to actually do it. And I'm really proud of Care in Kind because, we live in a very diverse city. I live in Queens, which is the most diverse, I think, area of the country. And in February, Care in Kind hosted our first diversity conference that focused on the health disparities that negatively impact the Black community vis-a-vis Alzheimer's and dementia caregiving. And so that is our real first formal, attempt to do the right thing and to continue doing the right thing as far as social justice goes.
Great. Really, really cool work, and well said that DEI truly is the responsibility of us all, right? So what are some strategies that you all have used to build a healthy company culture amid this pandemic, amid the Zoom world, right? So Amy, we'll start with you. Tell us about the company culture at your organization and how you build that.
Thanks, Molly. I mentioned earlier that we do have a set of values for our organization, and returning to those values in moments of crises can be very powerful. And we tried to make those values real throughout our communications, creating space for conversation around, how are we being responsible? How are we showing up for our fellow neighbors during this period of great challenge, locally, regionally, nationally, and internationally? That was key, but also bringing levity and where we could, bringing compassion all the time, and we had Zoom all hands twice monthly, more frequently than ever before, because we were absolutely conscientious to the need to bring connection to a socially distanced workforce. And those all hands were powerful. We developed a Site Life at its best recognition framework. So we had teams really looking across their entire sort of set of staff and saying, who's doing this above and beyond the call of duty? How can we surface that, celebrate it, and recognize that we can all play a part? And that was incredibly important, and in fact was one of the key reasons why, about 8 months into the pandemic, we set out our organizational health survey to all staff, and remarkably we saw an increase, 11% increase in staff confidence in leadership and the direction of the organization. It's because we were transparent. It's because we were forthright. It's because we were compassionate, but also because we were authentic and truthful where we needed to be in terms of the challenges that just weren't going away. We needed to walk through them together. In order to do that, we needed to bring them, all staff, on board.
Christian, same question for you. How have you built out the company culture at Caring Kind?
Yeah, it's such a good question because it's so hard to do. How do you suddenly feel like you're doubling your workload while also making it harder to work, harder to meet, harder to talk? Everything just felt more difficult and dangerous, right? It felt unsafe to leave your home. And so how do you continue doing your work, pivot to do your work in a new way and deal with your own the complexities of your own personal life and when you might be personally affected by this pandemic, either through your professional relationships, Caring Kind, I have a lot of elderly friends now, right? And so so their lives affect my life. And so company, let's take a step back. Company culture is always starts with the board and really the CEO. The CEO defines that company culture, right? And sets the standard. And we were very lucky. A year ago, we have a new CEO, and her name is Eleonora Tornator-Mikish, and she's been in the Alzheimer's caregiving space for the past 25 years. And so she actually started at Caring Kind as an intern 25 years ago, and she took the place of the CEO who hired her as an intern 25 years ago. And so she has done something I think is so healthy for any organization, which is to create a vision for the future that people can get behind. Whenever there's uncertainty drives inaction, and uncertainty depresses people because you don't know what's going to happen. You don't know where you're going to go. You don't know whether you should be bold and make decisions because the future is unclear. Having a new CEO with new energy and a new vision has really, and to come at a time of a global health pandemic, which it really upset the apple cart, and it really gave her the freedom to kind of define a new reality and to define a new future and let people define for themselves where they want to go. And having that space, and I know this is all very vague, kind of like, development talk, but it's actually true. She created an opportunity for people to imagine themselves and their work in this new paradigm. And that gives people not only the freedom to act, but we also celebrate it when people achieved things in a period of great uncertainty. And I will echo what Amy said, which is that we just completed our staff survey about a month ago, and we saw very similar things, right? People were actually a lot more positive about their work and about the situation of the organization than anyone expected. When you lose a lot of money because events are canceled and you feel the pressure of the pandemic, the expectation is that staff are just going to be negative across the board. But the opposite happened. People felt like it was an all hands on deck moment. And when you participate and you actually feel that that team spirit, that actually increases your positive feelings about the organization and your hope for the future.
Sure, well said. I think that vision, cohesive vision, is so important to bring everyone along and really kind of bring everyone's work together. So in, kind of a bit more of a logistical question here. So we all in the nonprofit space know how important earned media is in marketing strategies, right? So how have each of you worked with media companies to ensure a quick turnaround of earned media, making sure you're really keeping that ball going? So we'll start with Amy on that question.
Sure. We were joking earlier about advertising and paid media, and I haven't had a budget for advertising for years. So earned media is incredibly important. I know what a great media maven and an agency can produce. 100%, you find the right person with the right contacts, and you can accelerate coverage in ways that a smaller nonprofit or even our smaller team might not be able to do because of bandwidth and capacity. But the best results I have ever seen come from tried and true relationship building, putting in the research to understand beats, why a reporter, editor, publisher might want to hear from you or include your SME's hot take on anything. And this approach doesn't translate into good ink overnight, but sometimes the best things you need require that back end work. Or in this case, on my team, virtually just making sure that we were having those coffees, that we were still networking, that we were still cultivating those relationships in this new digital first world, so that we could better understand what might be the right angle down the line to generate the faster but also right kind of coverage to achieve our goals moving forward, especially during periods of crisis.
Great. Same question, Christian. How do you keep the earned media train moving forward?
I feel like Amy and I work for the same organization because there's so much, so much similarity. Because again, like Karen Kind has not had the budget for really broad advertising campaigns, right? One of the reasons why I started the podcast in 2018 is because when we disaffiliated from the Alzheimer's Association to Karen Kind, we all, disaffiliation is one thing, reinvention is quite another. And reinvention takes just as much time, effort, and money than disaffiliating does, right? And so by that point, we just didn't have the budget to kind of promote the new brand through paid strategies. And that's why, again, the podcast came to be, in part because we wanted to really occupy the space of Alzheimer's caregiving and be known for who we are now, which is the heart of Alzheimer's caregiving and the care and support for people with dementia and their care partners. And so that's the side that we led in. However, paid and earned media is still so very important. And so one of the things that we did earlier this year was contract with a public relations firm who can help us not waste our time, right? We have so few resources in order to get seen and heard in a fractured digital print landscape that we didn't want to waste our time creating press release after press release after press release. We needed someone's support and expertise and guidance to help us craft only those messages that were most likely going to resonate with the gatekeepers in paid media outlets. And that has been really helpful. And it's been an education for us, and it's also gotten results for us. And also including the strategy of don't keep these two issues separate. Let's combine these two issues because that's more compelling and more likely to go. So that's been, really helpful for us. And so if I were to say anything, it's an example of how everyone needs support in different ways, and you need to know your strengths, but you also need to know when to ask for help. And when it comes to kind of for paid media, I just need help, having money to pay for it. But when it comes to earned media, that support from the public relations firm has been really, really invaluable.
Great, really interesting. So thank you guys so much for these, insightful thoughts and really great conversation. And, goes without saying, but it's no surprise that one of your peers or coworkers nominated each of you for this award. So congratulations again. You really demonstrate leadership and vision that really, is exemplary in the marketing space. So congratulations. So as we start to close out this session and wrap up, I certainly encourage the audience to chat in the chat box, ask any questions of Christian or Amy. Happy to have them answer those. But as we kind of wrap up, do you all have any kind of last food for thought about how nonprofit marketers, excuse me, can pivot with purpose as they really navigate these changing times? So Amy, we'll kick it to you.
Well, thank you, Molly, and thank you, Christian, again, for this amazing conversation. I've learned so much. I mean, we definitely have decades of experience behind us, but I think it's really important that we continue these conversations and continue to learn from each other's experiences and grow continuously. But I have circled the sun enough times to know that the times will always be changing, right? Pandemic aside. Agility, adaptability, these are fundamental to our success at marketers. Keeping your thumb on the pulse of things is great, especially as technology continues to unlock new frontiers of functionality or provide podcast platforms for Christian and his team, et cetera. But you will up-level your role and impact when your line of sight takes you to edge cases and beyond. Often that is where the magic happens. But fair warning, right? There won't be a playbook. You'll have to write it yourself. And that's why the AMA community is so great, because going at it alone can only make you go so far, right? To be able to share stories, share experiences with grace as cats come on our laps during these interesting and unusual times, I think is what we all need more of continuously into the future. And as we adapt, as we learn to share those insights so we can help our sector be impactful and serve our missions.
Well said. Christian, last thoughts from you.
Well, how do I follow that? That was so good. I can see why Amy won this award. This is, she really knows what she's talking about. And again, I echo everything that you said. It's so easy in the world of marketing to get caught up in the latest Facebook blueprint and this Twitter algorithm, and you just you have ironically end up in a funnel of your own making, because you just keep looking at how to get things done logistically. And we're all kind of a victim of that. And you have to do the work, and you have to get caught up in the details. So the challenge is how do you always keep yourself stepping back and looking at the bigger picture? And everyone's situation is unique. One of the hard things about listening to people's advice is that advice, sometimes it works, sometimes it's just not relevant. And you have to kind of listen to enough to figure out what's right for you. And as Amy mentioned, you have to figure things out for yourself sometimes. And that's why, but you can figure things out for yourself when you're in a larger community, and having that support like the AMA community of marketers is so incredibly important. And if you're not in marketing, find your own community of support, right? If there's one thing I've learned in the past few years of doing this kind of marketing outreach and communication for Care and Kind, is that, it's easy to get caught up in social media posts and this, that, and the other thing. But when I find that when I start I take the marketing hat off and I just simply ask the question, how does this effort help someone? how is what I'm about to send, either by email or podcast, or if I want to do a direct mail letter, do I want to do an event? The first question that I should ask myself is, how is this actually going to help a caregiver in real life? Even if it's just, because we sometimes think of direct mail fundraising letters as a way to get cash in the door to pay for our programs. But it helps if that direct mail fundraising letter actually helps someone. So is there a way you can put the caregiver first, put the recipient of my effort first, and solve a problem, answer a question, connect them to a resource, while also following that with a request for partnership and financial support and moral support and volunteer support and all the kinds of support that every nonprofit organization needs in order to do our jobs. And I think one of the reasons why the podcast succeeded was because, I didn't worry about metrics. I wanted to create something that did a service to caregivers, and I just hoped for the best. And I was glad that it worked out as well as it did. So that strategy has helped me craft better emails, better newsletters, better videos, better subject lines, better personal interactions. And while it's easy for me to play the role of a marketer or a fundraiser trying to achieve financial goals, I now ironically see myself more as a program person than just a marketer who's just trying to get clicks, right? I'm part of the team that's trying to make the world better for people with Alzheimer's and dementia and their care partners. And that makes it feel more holistic and just better for me and for our community.
Great, absolutely. Being, part of that larger community, I think, is such an important thing for marketers to remember. It's really easy to get in your own kind of world and your own kind of goals, right? And taking a step back and really thinking about what the organization is doing is so important. So thank you both so much for these incredible insights. I know the audience has found it really, really insightful. Definitely encourage everyone to head over to the AMA booth in the event environment. There's lots more content, including videos from Amy and from Christian, content around not only their work, but around the AMA Foundation, around the AMA Foundation's mission, and how you all can get involved in a variety of ways. So thanks again, everyone, for joining, and congratulations again to Christian and Amy. Thank you for being here.
Thank you.
Thank you.